Welcome to Variations 4, the neurological unit. In this video, we'll be covering question 18 to 20. Our topics are basically spinal cord injury, SCI, talking a little bit about T6 injuries, C4 injuries, and two types of shock that can come with spinal injury. Number 18, why can't someone with a T6 or higher spinal cord injury be taught deep breathing and coughing? At what level of spinal cord injury is mechanical ventilation required? Let's look at a picture for this stuff. So if you look just over here, first of all, let's get a general sense of what's going on here. Obviously, this is the spinal column. And you've got the brain, obviously somewhere past C1, up in the cranium. You've got the brain. Now, the idea, as you know, is that the brain communicates with nerves, and nerves run through the spinal cord out to various areas of the body. And we're just going to assume for ease of discussion that when we talk about spinal cord injury, we're talking about complete injury where there's no communication with the said nerve. So for example, if we look at T6, which was the first part of question 18, if you look at the level of T6, everything above T6, in terms of breathing, you've got some chest muscle activity. So above T6, you've got nerves coming out, controlling some of the chest muscles. As you can see, some of that's above T6. You've got the thoracic muscles that would be controlled up here above T6. You've got the diaphragm all above T6. So as long as everything's in good health above T6, well, then the brain can communicate with all these different muscles, and breathing shouldn't be too bad. Now, if you have an injury, spinal cord injury, somewhere above T6, let's just say, for example, so the key here is somewhere above T6. And this is take, for example, say T2. Well, the problem then is the brain won't be able to get past T2, and therefore won't be able to communicate with some of the thoracic muscles, with a lot of the chest muscles. That patient's going to have a problem deep breathing and coughing. They're going to have a problem clearing secretions. So, they might need chest physio. They might need tracheotomy with a trach appliance attached that can be suctioned. Now, the second part of question 18 is referring to the level of C4, the cervical spine 4. Now, if you look here, you can see that cervical spine 4 is kind of where the diaphragm is controlled. So if we had good health, say we had an injury above T6, but it was below C4. So in other words, everything above C4 was in perfect health. Well, then the person might be able to breathe on their own because the diaphragm's still working. The brain can communicate with the diaphragm, but they're going to, as I said earlier, they're going to need some maybe chest physio, maybe some suctioning, maybe a tracheotomy. But now if we change that and say the injury is above C4, so C4 or higher, now the brain can't communicate with the diaphragm, and this person is going to need a lot of help breathing. They will need a tracheotomy, and they will need that to be attached to mechanical ventilation because the diaphragm is not working. So that's question 18 for you. Next question is, what is spinal shock? What is meant by the idea that it may mask future neurofunctioning? The answer is pretty clear right here. So a loss of sensation and movement below the injury site. So if we imagine the person's, like from the diagram, had a spinal cord injury at T6, then functioning below T6 would be impaired when they're in spinal shock. You see, because it's an injury below, it's a loss of sensation below the injury site. So let's just go back to that diagram there to make it clear. So say they had an injury here, and let's just say it was at that level of T6. We expect some problems for sure higher than, for things below T6, because that's where the injury is. The brain can't communicate well beyond that point. But when they're in spinal shock, it might cause additional problems, whereas not much at all might be working below T6. And over the days and months to come, some of that functioning may return as the spinal shock wears off. So again, an injury above T6 means the brain can't communicate well with things below T6. But we don't know what the long-term outcome will be, because spinal shock may cause a lot more things to stop working below T6. That's kind of the simplistic explanation of spinal shock. And finally, question number 20, explain neurogenic shock. For injuries above T6. So T6 is a pretty significant site for us here. What we assume then is that if the injury is above T6, the influence of the sympathetic nervous system is decreased. And as you know, sympathetic nervous system you associate with fight or flight, so they'll have a drop in heart rate and a vasodilation, a drop in BP. Now, it can last up to 6 weeks. They could have cardiovascular symptoms such as low blood pressure, such as low heart rate, and that may wear off. It's a type of shock that affects the sympathetic nervous system. Specifically, we see in cardiovascular signs and symptoms, like right here. It can wear off though, and it's called the neurogenic shock. So just to put a picture to what was said in terms of neurogenic shock, if you have, I mean, if you count down here and you got T1, 2, 3, 4, 5, 6, somewhere around here is your T6. If you have perfect health of all your connections above T6, then the brain can communicate with the sympathetic trunk, all the sympathetic activity. A lot of it can be controlled by the brain. But if you have an injury somewhere above T6 that could be inhibiting the brain's ability to control the sympathetic functioning, then you get that drop in blood pressure and that drop in heart rate. Okay, so that neurogenic shock could wear off. I just want to give you a pictorial look at that.